welcome to today's PHN Talk Series. My name is Olabisi Dabiri. The purpose of PHN Talk Series is to learn and share ideas on how to improve the health outcomes in Nigeria. The topic for today's discussion is innovation in service delivery, and I have here with me Dr. Femi Sunmonu, the co-founder of PurpleSource Healthcare. Welcome to the show.
Thank you.
To start off, we had a few people sending questions concerning innovation in service delivery, and I'll be asking you some of those questions. So would you like to tell us what PurpleSource does and what you do?
Okay, sure. I think there's the sort of technical bit of what we do, but I think essentially what we're trying to do is we're trying to solve problems for Nigerian people in healthcare. So we're trying to provide solutions that can meet their basic needs for health, security, happiness on a large scale. I think it's important to say that because I feel like the healthcare industry has kind of lost sight of what it's actually supposed to be doing. Healthcare is a social good. You can make money doing it, but at the end of the day, it's a social good.
It's to save a life.
It's to save a life and to keep people healthy. That's essentially what we're trying to do, and we're trying to do it for as many people as possible.
Okay.
Therein lies the innovation in how it is that we're trying to do it. So I think we're trying to improve outcomes on one end. We've seen in the marketplace that there's not much in terms of regulation when it comes to quality standards, which is why we lose so many lives in Nigeria. So we are sort of very focused on quality. We're implementing evidence-based guidelines in the way that people treat patients so that we can improve outcomes. We're trying to improve access to people because we also realize that the way that the market is, it's very fragmented. People sort of move from one provider to another provider. The information that happens in one place doesn't move to the next place. There's no proper referral patterns. And patients have a very difficult time navigating through the system. And it actually is very inefficient. It costs them a lot of money. So how we're addressing that is we're actually creating and operating and managing a network of healthcare providers, primary healthcare providers, so like GP practices.
Okay.
And we are trying to eliminate inefficiencies across the whole healthcare value chain. So if you look at the value chain for healthcare as the suppliers, let's say the pharmaceutical manufacturers, the distributors, then you look at the healthcare providers, which is us, the clinics, the hospitals, etc. The people who are paying for the care, whether that's an insurance company, whether that's a person that's paying for the care, and then the end beneficiary, who is actually the person whose life we're trying to save. So what we're doing on the end of supply, this manufacturing bit, is we're trying to reduce inefficiencies because we have a network of clinics, and that's our strategy to grow. We can bulk buy, for instance, so we can save cost that way, which we can pass on to the patient. So it lowers the cost of how we deliver healthcare. We can decrease inefficiencies at the level of service provision as well, because we've also seen that there's issues in the way that healthcare is being delivered in Nigeria.
Yes.
Polypharmacy, you come in with a fever, you get treated for like 4 or 5 different things because they're not quite sure what it is. Mostly malaria, typhoid, combination of malaria, typhoid, etc., and sort of hope for the best. And it's not efficient, it's actually unsafe.
Yes.
This is, I think, antibiotic or antimicrobial week, so there's a lot of talk about antimicrobial resistance, and I'm sure that in Nigeria it's actually already a problem. We're just not aware of what the issue is. So we're addressing those things by adherence to protocols, and what we've actually seen is that in a lot of cases, in our test cases, we've been able to improve their outcomes and also save patients up to 30% of the cost of care there. And I think eventually where we're trying to head to is to now reduce inefficiencies at the level of the population. Okay. So at scale where we are serving a large population, what we have, because our process is actually supposed to be technology driven, so we have access to information in real time, and we can understand what's going on with the health of the populations that we manage. So an example is, we have a population in Mushi, for example, that has we have a high incidence of hypertensive patients there. And if we can see this very rapidly, we can tailor interventions to actually keep that population healthier without waiting for them to come in. So it's a more proactive approach, which is what's required. The idea really is to build this to be something that becomes a pan-national network that can align incentives between all the different players within the healthcare space. So, the manufacturers are happy to deal with us because we're buying things from them in bulk, so they're happy to give us discounts. The hospitals are happy to deal with us because we're providing them with the patients that they actually need to see, as opposed to the ones that are showing up unnecessarily. The people who are paying, whether that's health insurance or the patients, are happy with us because they are reducing the overall cost of care. And when I say overall cost of care, if we're keeping them healthy and keeping them from having to come into the hospital in the first place.
Waiting until it gets really bad.
Exactly. Or decreasing the number of unnecessary admissions, for example. There's some very easy rules to look at. Does somebody need to be in the hospital? Are they eating? Are they drinking? Are they peeing? Are they pooing? Can they walk unaided? And do they not have pain? If you apply that to a vast majority of facilities in Lagos, you realize that half of the people that are there don't actually need to be in hospital. But that's a different story. And then the patients have because they're healthy. So that's essentially what we're trying to do.
Thank you very much for the brief background. What would you say? How important would you say innovation is in service delivery?
I think it's not even just that it's important. I think it's necessary, especially in our context in Nigeria or Africa. And you can look at it a couple of ways. So if you look at what's happened with the growth of our population in Nigeria, in 1960 we had 46 million people. Now we have more than 170 million people. And by all estimates, Africa is going to account for more than half of global population growth by 2050. So we're going to have 2.5 billion people here. Within that context, let's even just scale it down to Nigeria. We need 5 times more doctors than we currently have. And it's estimated that it's going to take more than 50 years for us to be able to produce the number of doctors that we have, assuming that none of them leave to go elsewhere for training. Our government at the moment only allocates 5-6% of the budget towards healthcare, and 90%, almost 90% of that is going towards paying salaries. So there's a very small amount of money that's being dedicated to actually move healthcare forward for 170 million people. And what that has resulted in at the moment is that we have, as you well know, that more than 1 million women, children, others die every year. There's a colleague of mine, Dr. Fumbo, and she actually puts it in perspective, because I think sometimes we get lost in numbers. People just spew numbers and they say 1 million and you just kind of roll your head. And she puts it very succinctly. And she says, imagine 7 jumbo jets filled with women, Nigerian women and children, crashing out of the sky every single day for a year. That is what currently happens. That is the reality of Nigeria right now. And so the fact is, we don't have the resources, we don't have the money, we don't have the doctors, we don't have the time really to solve some of these challenges. And so innovation is critical to what it is that we're going to do. I think, but in innovating, what we also need to be thinking about is, what does the future look like? And I think increasingly what we can see if we look outside of the continent, outside of Nigeria, is that healthcare is going to become increasingly personal. People are increasingly going to have to be looking after themselves. Technology is evolving to the point where you may not have to see a doctor. So we need to think about what's healthcare going to look like in the future, and then the innovation needs to be about trying to get there. So it may not necessarily be about training more doctors right now because we can't get there. So that might not be what the innovation is. It might be about using technology to harness some other way of building capacity, or training a different cadre of people, or using technology to harness the scarce resources that we have now and share them amongst as many people as possible. Part of what we're trying to do within the network, for instance.
Okay. So our next question is, there are recent innovations developed across the globe, including Africa, are disruptive. They're targeting improving lives of people, right? How would these innovations, right, connect to the current healthcare system? So how would they go in synergy with what current policies are?
Okay. So I think this question is a bit of an oxymoron, in that innovative disruption, by definition, is something that's actually creating new markets and value systems. And so what it's actually doing is it's actually displacing the way in which we're currently doing things. So that's not to say that there's no way for it to integrate, but I think truly innovative disruption in the healthcare space is actually going to change the way in which we deliver healthcare. And so there might be some clashes, which I think people have seen already, and hopefully somebody has a question on that. I think there are 2 dimensions to this kind of disruptions. I think there's on the consumer side, and then there's also sort of all the other players within that market that are being disrupted. So the entities and individuals that are involved in providing services and products. And they come with different challenges. I think the challenges on the consumer side are really about changing people's behavior, and that really is a lot to do with education and communication. So if you have time and you have a little bit of money, you can usually sort of overcome that challenge. I think the harder challenge is in the rest of the market players. So, usually what happens with these types of disruptions is being done by outsiders, and then you're upsetting existing market-leading companies that have invested lots of time and effort in infrastructure and processes to be where they are. And I think that then poses a challenge. Now, disruptive innovation doesn't always come from outside. Sometimes big companies decide to innovate, but I believe for the purposes of this discussion, we're sort of talking about small innovators like myself and maybe even smaller who are trying to do things. So I think that in itself becomes a challenge. But I think that as innovators, part of our jobs are also so we can't ignore it, right? It's going to come and bite you at some point in time, whether it's regulation, whether it's in the form of competition or just obstacles that come your way. And I think we basically also have an additional job in that we have to basically advocate for ourselves, and we need to bring those people along and explain to them, teach them why what we're doing is actually for the greater good, and try to carry them along as much as possible. And I think organizations like Private Sector Health Alliance are kind of useful. They're a useful link between innovators and policymakers and private entities in a way that is really non-threatening and really talking about collaboration. I think that makes things easier than trying to go about doing it yourself.
So there's this big misconception that innovation is basically technology, right? As opposed to just doing something different, right? You have like chlorhexidine for cord care. It's a different way to do something good. So it makes it difficult for a lot of innovators to start or even scale up their innovations, because some, are kind of nervous that, maybe because I don't have anything tech related, it's really not an innovation. So what would you say are the barriers they could face, and how do they address these barriers?
Okay, so I think you're very correct in that innovation is definitely not really about tech. Innovation can be really, really simple. Innovation can be as simple as having a different form that people fill that gives you more information, allows you to treat the patient faster. It can be as simple as training a midwife to do ultrasounds and then giving her a portable ultrasound to go around to people's homes to do ultrasounds instead of them coming to hospital. I think some of the challenges, from my perspective, let's say, in terms of starting a venture or thinking about innovation, is really about confidence in your skills to do it, because we all have really good ideas. And usually when innovators are coming up with ideas, they're coming up with big ideas. So they're coming up with ideas to kind of really change whatever the landscape is that they're trying to address. And what comes with that is you realize the enormity of what it is that you're trying to take on. And the first thing that pops out is you don't have the skill set, you don't have the knowledge, you don't have the money to be able to do it. But I think in seeking out other innovators, in seeking out platforms that support innovation, like Private Sector Health Alliance, you are better able to get confidence, first of all, and support in terms of doing this, and then you realize that you actually you can start pretty small, and your financial requirements may not be that large in order to start. So I think that's sort of one of the main challenges I see to starting. I think to scaling is a slightly different challenge, and I think it's because there's a mismatch between the skill sets that are required to start something versus to grow something. And I think it's part of the challenge that we have in Nigeria. You see a lot of businesses that don't grow past a certain point. Some of it is because it's that sort of owner-manager mentality, but also in some cases just because they haven't really figured out how this thing can run without them. I think that's
sustainability factor.
Sustainability factor, it's a big issue. There are lots of different things that you need to think about when you're talking about scale. What are the inputs that are needed for this to run without you? How much money is required? What kind of skills do you need? The skills that you need to create your liver product are different from the skills that you need to run something at scale, and you need to be able to be thinking about that. I think part of the challenge at scale also is that you need to be thinking about scale from the very beginning. So every step of the way in what you're doing, you need to be thinking about how does this work without me, times 50, times 100. And I think there's some very practical things that people can do in terms of looking at your product, understanding the business unit economics of your product. So simple things like how much does it cost to actually produce this service or product? How much can I charge for it, and what's the margin? That's the first step that you can do. And then that can be plugged into some sort of financial model where you say, okay, fine, if I need to go to 2,000 of these products, what are my operational costs actually going to be? And it forces you to sort of think about it. You're like, okay, it's just me, but maybe I need an additional person. How much you cost, you can add that to whatever it is. And it starts to show you a picture. And in some cases, it may show you a picture where at scale, your intervention, the way in which you model it right now, is actually not sustainable. So your costs might actually eat into all your revenues and you lose money. But what that then does is, at this stage, you can now start changing your model to make sure that the costs don't overtake your revenues. I think the other thing that's going to be important for scale is that you need to do your research. There's usually some market that you're trying to address, and you need to be sure that you're not underestimating that market. You're not underestimating what's going on within that marketplace in terms of competitors and all that stuff. It doesn't have to be something that's super rigorous, but you need to sort of constantly.
The industry.
You need to understand. You need to understand that so that you don't fall foul. So that those are some of the barriers there.
Okay, so the next question is, the issue of patenting and trademarking and innovation is a development some innovators do not consider. What are the inherent dangers with this?
Okay, so from a Nigerian point of view, I think enforcement of any sort of IP type of dispute, I don't know how successful anyone has been in that space. I know of people who've equally found it super easy to patent things that sometimes do not deserve a patent, that actually have been patented somewhere else, and some people who have difficulty doing that. But I think, and even if you look outside of Nigeria, right? So a company like Apple holds hundreds, if not thousands, of patents for its products. But if you look at all the smartphones today, all the computers today, they all do exactly the same things. They function in the same way. They have the same features, basically. And I think what's actually more important. So you can. I think you should, if you can. I don't know that I would hang my hat on IP, because I think I personally think that no ideas are original. I don't actually believe in intellectual property in that way. Okay. Doesn't mean that I plagiarize, but I really don't. I think, but I do think that if innovators can really focus constantly on trying to meet the needs of their customers, so they will constantly be innovating to meet those needs, because we're never going to be satisfied. You're never going to create a product and then that's it. There's always going to be something else. So if you're constantly meeting the needs of your customer, then you don't have to really worry about IP. Someone will always come along and do what you're doing. You can do stuff to try to make it difficult for them to enter the market. That's a strategy. But I think it's okay as a short-term strategy so that you can build up. But in the long term, you really have to be solving problems. Like, if you're always solving people's problems, then you'll always be one step ahead.
So the last one is sort of a lack of interest from health professionals to accept new innovations. How would you say innovators can sort of get the health professionals to get on board with whatever product or process they're trying to market?
I think the first thing is that the innovators need to be aware of what some of those issues are and motivating factors are behind non-adoption. It could be, in some cases, that healthcare professionals simply don't see the value in what it is that we're trying to introduce, and then what that means is you spend a lot of time educating them on it. But the other thing also that they need to be aware of is that some of these innovations are going to be removing inefficiencies that institutions and individuals have been benefiting from for years. And it's not a Nigerian thing. It's not peculiar to Nigeria. It's a global thing. If you look at healthcare systems like the United States, the vast majority of the opposition to things like Obamacare have to do with the fact that there are billion-dollar industries that have been built up around that inefficient system. So you proposing something that decreases the bottom line for them is something that they're going to fight against. And so it's the same here, except that maybe in Nigeria and Africa they can be a bit more brutal in the way in which they tackle those issues. I think I always tell people, like, if you want to pick a fight with your financial controller or whoever it is that's doing accounting at a hospital, usually sometimes it's the doctor owner, go talk to them and tell them about your cool little idea that you have for improving patient outcome. But what it does is it reduces the need for them to have so many medications, it reduces admissions, and it might even reduce the need for surgeries, and see what happens in that particular case, when you're talking to someone who is really focused about the bottom line. But I think it's not just one of those things where I'm ragging on people saying that all they care about is money, because sustainability is important, and a lot of times these innovations actually are decreasing the costs and may be putting people out of work. And so there has to be some sort of mechanism in place either to protect these systems, but I think even to innovate some of those inefficiencies out, and we need to be looking at that going forward.
So our very last question is from one of our innovators, and it's, how do you get rural communities to buy new healthcare solutions where they're used to getting things for free, or they don't see the value as much as paying for their DSTB fees?
Right. Okay. I think that there may be some assumptions that are made about rural communities, or poor people in general, which is that they don't appreciate what it is that people are bringing to them. I still think everybody has those basic needs for health, happiness, security, and sometimes it's really a question of, are you communicating that to them? Do you understand that that's what they're looking for? You may have a healthcare innovation that makes sense to you, but is it solving a fundamental need of these populations? So that means you need to really take some time and speak to those communities and understand what it is that they want. It might be an issue of dignity as opposed to healthcare in the way in which you're thinking about it, and then you have to change the way in which you present your solution to them. And also bear in mind that some, these communities have become sort of fertile ground for experimentation. So they've tried, lots of things have been thrown at poor rural communities that haven't worked. So a lot of them have fatigue around adopting some of these challenges. But I do think that the government has a large role to play, especially when we're talking about bottom of the pyramid, like super poor, who maybe really can't afford to pay, and then somebody needs to be able to step in to help them.
Thank you very much for your insights. Thank you very much for joining us today. And thank you everyone for watching. Please, if you would like to watch this video again, just go on our YouTube page, which is Private Sector Health Alliance of Nigeria, to watch the video again. Please don't forget to share, and then don't forget to join us on that's at PHN_Alliance on Twitter and on Instagram, and then on Facebook and Google+, it's Private Sector Health Alliance of Nigeria. Thank you very much for watching.